Hi guys. My name is Aliona and I'm gonna talk about proteus syndrome. What is proteus syndrome? Proteus syndrome by definition is the excessive growth of tissues, bones, or skin in parts of our body. Usually, this abnormal growth is asymmetrical, which means the left and right sides of one's body is affected differently. The known cause of this syndrome is a random mutation or a change in the AKT1 gene which only affects certain body cells, thus explain the differences in each individual who are affected with this syndrome. People with proteus syndrome may also be affected neurologically. This includes intellectual disability, seizures, and vision loss. Now, let's talk about the discovery. Interestingly, this syndrome is named after a Greek god Proteus who had the ability to change his shape by a German pediatrician. However, it was first described by Samia Temtami and John Rogers in 1976 in an American medical literature. And in 1979, Michael Cohen was the first doctor to diagnose a case like this. Since this is a rare condition, diagnosing Proteus syndrome can be difficult. Some doctors are unfamiliar with it as it is a rare and unfamiliar condition. However, a biopsy to tissue or tumor may be taken to check if a mutated gene AKT1 is present. If the mutated gene is found, necessary steps may be done such as X-rays, ultrasounds, and CT scans to look for internal masses whether it is benign or malignant. Although diagnosing can be a challenge, symptoms may tell a lot about what condition the patient is currently showing. The symptoms varies differently with each individual, but it typically includes tumors on skin, rough skin lesions, and even growth of limbs where one leg appears longer than the other, scoliosis, thickened skin on soles of the feet, and because of malfunction in central nervous system. It may also affect facial structures such as unusual long face, drooping eyelids, and wide nostrils. In the picture, we see enlargement of the feet and abnormal formation of limb. Because of the excess weight and enlargement of the limbs, it could also contribute to arthritis and muscle pain to the patient. There are terms we could use to describe the abnormality. First, mosaic distribution. This refers to an uneven abnormal growth of tissues that only certain parts of the body are affected while keeping other areas unaffected. And this also explains why one person may be affected differently than another person. Second, sporadic occurrence. This means that there is nobody in the family who has similar features of overgrowth. Lastly, progressive course. This describes the noticeable altered appearance of the affected body parts over time. In severe cases, a patient might develop large masses, resulting in organs being pressed down due to large tumors which may cause the lungs to collapse. In some cases, a patient may also experience mobility loss due to overgrowth of bones. In the worst-case scenario, a patient may develop deep vein thrombosis, where blood clot is formed in deep veins, usually in legs, and this clot may break off and travel freely in the blood flow as seen on the picture attached. If this clot happens to block on the artery of the lungs, which is called pulmonary embolism, it can lead to death, which in fact the leading cause of death for people with proteus syndrome. In severe Although there is no cure for proteus syndrome, a treatment may be given in the form of oral drug called rapamycin. Since this syndrome affects different parts of the body, an individual may need multiple or combination of treatments depending on each case. Orthopedic procedures may be required through a surgical process to remove overgrowth tissues and remove growth plate on bones to delay or prevent excessive bone growth. As for vein thrombosis, it must be monitored to aid the patient as early as possible. Although there's That's the end of my presentation, and here are the sources where I took the information from. Thank you for listening.